Welcome to this third webinar sponsored by the Maricopa County Department of Public Health on the Affordable Care Act. My name is Lori Stillman and I'm from Health Resources in Action, a national nonprofit public health organization located in Boston. We've been engaged by the Health Department to help them better understand their role in preparing for the full implementation of the Patient Protection and Affordable Care Act, as well as the role that their partners can play in ensuring its efficient and effective implementation in the state of Arizona. And so to that end, we've produced some in-depth technical reports, special subject fact sheets, and webinar presentations that are tailored specifically for the healthcare, community, education, and workplace sectors. Yesterday, we presented webinars geared to the healthcare and community sectors. And today, we're presenting two additional webinars. The first one is on how the ACA can impact the education sector. And then at 11 a.m., we'll present another webinar about the ACA and how it can impact the employer and business community from a public health perspective. These presentations are focused specifically on opportunities as they relate to the Affordable Care Act, not all of the ways that you can work together to promote healthier people and healthier communities in Arizona. The presentations will be approximately 30 to 40 minutes long, and then we'll have some time to field your questions. Two caveats, however: the information and recommendations contained in these presentations are an expansive set of opportunities for working together with your health departments under the ACA. The information is meant to stimulate conversations and a planning process where together you can prioritize what opportunities are the most important and realistic to undertake. Secondly, the reports and fact sheets, as well as today's recordings, will eventually be posted on a public web page that the Health Department is in the process of creating. They will be providing you with updates on its progress as well as other relevant information as they become available. So please tell your colleagues about how they can connect with the Maricopa County Public Health Department to learn more about these topics. So now let's get the webinar started. Brittany Chen will be the presenter on behalf of Health Resources in Action and will focus now on the education sector. Due to the large number of participants, nearly everyone will be on mute, so you'll not be able to communicate verbally with us. However, we encourage you to write your questions in the Q&A dashboard on your webinar screen at any time during this presentation, and we'll try and answer some of them, or as many as possible, at the end of the presentation. Please don't use the raise your hand function on the dashboard, however, as this will only tell us that you have a question, not what the question is. And those questions that don't get answered will be forwarded to the Health Department, and they'll communicate to you the answers at a later date. Finally, after the webinar concludes, you'll see a very short survey which we hope you'll complete online. So thank you for your participation, and we want to let you know that if you participated in yesterday's webinars, the first few slides will be a repeat of that information, but there'll be a lot of new information that will be presented thereafter. So here's Brittany Chen.
Good morning, everyone, and thank you, Lori. It is great to be here with you all, albeit virtually. Today, I will be talking about the impact of the Affordable Care Act, the significance of schools on population health promotion, Affordable Care Act provisions that relate to school health, and specifically school-based health centers and how to promote healthy school environments. And finally, we will be talking about strategies for schools to promote health. So let's start with the impact of the Affordable Care Act. One of the most important aspects of the Affordable Care Act is the increased number of people that will be enrolled in health insurance. As of January 2014, 1.3 million people in Arizona are expected to gain coverage either through enrolling in Medicaid or in private insurance through the state's exchange. This number may be even higher as Medicaid was officially expanded in Arizona last week. It's not completely known yet how this addition of insured people will affect the healthcare system, however. There have been studies of the current uninsured population, and they suggest that they may be in poorer health than the currently insured, and that they may have a pent-up need for services. Many of the people who become insured in 2014 will be new users of health insurance. They may need assistance in enrolling for coverage, understanding the benefits that are available to them, and the appropriate site for accessing different types of services. For example, they may be used to getting care in free clinics or the emergency room instead of with primary care providers, and thus they might need education to help make those change. Also, there will be a continued need for safety net services. Approximately 650,000 people will remain uninsured, including undocumented immigrants, people waiting to qualify for benefits, and people whose Medicaid status will change due to meeting eligibility requirements, and this is often known as churning. Safety net providers will continue to be an important source of care for this population, as well as newly insured patients who would like to continue at community health centers where they've been treated in the past. With this increase in insurance coverage, there will likely be a resulting and hoped-for demand for primary care and prevention services. And this increased insurance coverage and demand in services, coupled with the remaining uninsured population, provides opportunities for the public health field in the Affordable Care Act. So people often think that the Affordable Care Act is mainly about health insurance. While that's an important aspect of it, that's not only what it's about. Its major focus is actually referred to as the triple aim, which includes improving the quality of care, improving population health outcomes, and containing health care costs. Population health means improving the health of the whole population, not just focusing on individuals. This requires reducing health inequities among population groups and addressing the factors that impact health, which is often referred to as social determinants of health. These include the physical environment that people live in, employment opportunities, and education. Population health focuses primarily on primary prevention, which means focusing on preventing the occurrence of diseases and injuries, and also helping people manage chronic illnesses that they have more effectively. So, the focus of the ACA is broad, and to meet these goals, the work of multiple sectors are all needed to focus on the real drivers of health. This focus is a major change for the healthcare system, which will have increased responsibility for good patient health outcomes versus just providing services. However, many healthcare providers are not expert in population health, prevention, and disease management. Healthcare providers are generally unfamiliar with how to connect to community resources and how to improve communities themselves as a strategy to improve patient health. So this is where public health is primed to come in. For this webinar, I will focus primarily on strategies to improve population health within the educational sector. However, focusing upon improving population health will also likely lead to a better experience of care and lower per capita costs as well. So this is important for the triple aim. I apologize. So now let's talk about the significance of schools for population health and why we should focus on schools. Kathleen Sebelius, the Secretary for the U.S. Department of Health and Human Services, said, "Children are the foundation upon which this country will grow." As children, adolescents, and much of the educational workforce spend the majority of their waking hours in school, it is important to think about the educational sector as a way to promote the health of the population. Looking at the 2012 census for Maricopa County, almost 1 in 5 residents is between the ages of 5 and 18, and thus are of school age. Taking into account college-age individuals, this percentage increases. Also, according to the Bureau of Labor Statistics, almost 15% of Maricopa County's working population was employed in the education and health services sector in 2012. Thus, addressing school health is critical. Taking asthma, for example, it has been found that teachers have high rates of occupational asthma due to the poor indoor air quality of schools. And it would follow that if teachers are presenting with high rates, the same would be found in students and other staff members. Thus, taken together, efforts to promote school health have the potential to impact a significant portion of the population, reaching students, parents, faculty, administrative staff, and any ancillary staff, such as food service personnel, bus drivers, and custodial workers, just to name a few. Beyond sheer numbers, these efforts can also reach individuals from diverse socioeconomic backgrounds. In addition, health and educational attainment are interdependent. Good health leads to better academic outcomes, and higher educational attainment is associated with better health over a lifetime, with education being the #1 driver of health status. To address school health, the Affordable Care Act provides opportunities for investments in the health promotion of students and adults to ensure that they are ready to learn, work, and thrive. So now, let's talk about the Affordable Care Act provisions and school health. The ACA aims to increase access to clinical and community preventive services through the expansion and support of school-based health centers. To do so, the ACA appropriated $200 million in capital grants for school-based health centers over 3 years and authorized a federal grant program for school-based health center operations. Between fiscal years 2011 to 2013, $189 million in school-based health center capital program funds were awarded to 520 U.S. school-based health centers to support capital investments. These capital investments include the acquisition and improvement of land, construction costs, purchasing licenses for electronic medical records, and different support like that. It also can improve and expand school-based health centers. By December 2012, almost $1.8 million in capital grants were awarded to 4 Arizona applicants. However, none of those were within Maricopa County. For your interest, grantees were located in Apache Junction, Green Valley, Prescott, and Somerton. To date, no formal appropriation has been established for a school-based health center operation grant. However, advocacy is continually occurring at the national and local level for funding. Just for a little bit of a school-based health center 101, school-based health centers provide developmentally appropriate comprehensive health services to youth, regardless of their insurance coverage or ability to pay. School-based health centers provide primary health care services such as treatment for acute conditions. This includes sore throats and earaches, chronic disease management such as asthma, and preventive services such as immunizations, physical exams, and health education. These centers are staffed by nurse practitioners, physician assistants, and/or physicians who work in partnership with school nurses, teachers, and other staff. In Arizona, 82% of children who use school-based health center services are uninsured and receive services free of charge or on a sliding scale. While a greater percentage of these children are likely to have health insurance coverage with the full implementation of the ACA in 2014, some still won't. Thus, school-based health centers services greatly impact the well-being of the population's most vulnerable children. The ACA defines school-based health centers as clinics that are located in or near a school facility or of a school district or board or of an Indian tribe or tribal organization, organized through school, community, and health provider relationships, administered by a sponsoring facility, providing primary health services by health professionals to children in accordance with state and local law, and they satisfy any other requirements that the states might establish. School-based health centers are most frequently sponsored or operated by a local healthcare organization, such as a community health center, hospital, local health department, or school system. The sponsoring agency may lead administrative operations and partner with community health and wellness practitioners to provide services outside of the agency's scope of activities. And so this could be like a medical lead organization contracting with a local mental health to provide on-site services. School-based health centers can function in a variety of ways. Some are located on and serve a single school campus. Others may serve nearby feeder schools. And with school-linked services, a provider may periodically visit a school to conduct screenings and educational sessions with follow-up visits occurring in their usual clinic setting. The majority of U.S. school-based health centers bill public insurance programs, including Medicaid and the state Children's Health Insurance Program, private insurance, and students or families directly. However, challenges to billing insurance for school-based health center services exist. Even with the ACA, as already mentioned, many school-based health center users will remain uninsured and thus will continue to limit billing options. These youth may include those from undocumented families or from immigrant families awaiting eligibility. Also, school-based health centers struggle to bill insurance for the following reasons. School-based health centers are not designated as a student's primary care provider. Patients are enrolled in multiple public and private health plans. There could be insufficient staff to bill for services and monitor outstanding payments. And the many educational and preventive services performed by school-based health centers, including case management, health education, and teacher consultation, are often not within the scope of a billable visit. So as a result, most school-based health centers have diversified funding sources. In Arizona, funding is provided by hospitals, public and private foundations, the federal government, including Indian Health Service, and school districts. The opportunity to build up school-based health centers' billing capacity is critical to accommodate the likely influx of newly insured and the remaining uninsured population and build their capacity for their sustainability in the future. While school-based health centers are an excellent way to provide clinical services, the ACA recognizes the need to go beyond clinical services to promote the health of the population. As such, the ACA also promotes prevention through the promotion of healthy and safe community and school environments. Workplace wellness efforts are one way in which the ACA promotes healthy school environments as it addresses schools as employers. At 11 o'clock today, as Lori mentioned, we have another webinar focused solely on the employer sector, so please join us for that if you want more depth on this topic. Additionally, one of the important ways that the ACA supports population health and primary prevention in schools is through the establishment of the National Prevention Council, which developed the National Prevention Strategy and Action Plan. The NPS is the national blueprint of principles and strategies for improving health in the communities where people live, work, play, and learn. The NPS outlines 4 key strategic directions, including building healthy and safe community environments, expanding quality preventive services in healthcare and community settings, empowering people to make healthy choices, and eliminating health disparities, which means differences in the incidence, prevalence, mortality, and burden of diseases and other adverse health conditions that impact specific population groups. It's worth mentioning that while people often think about the importance of eliminating disparities, an important related focus is promoting health equity, which means working at the community level to address unfair distribution of resources in communities that can lead to poor health in the community. As schools reach children of diverse backgrounds, they are an important setting to consider in the promotion of health equity. The NPS includes specific recommendations for schools, which I will list later in the presentation. But the coordinated school health model is one comprehensive approach to fulfilling these strategies for schools. Finally, the ACA provides new funding streams for community-based initiatives to prevent chronic disease. The Public Health and Prevention Fund was established by the ACA to redirect health systems towards prevention and strengthen the capacity and impact of the public health system. The Public Health and Prevention Fund was funded by the ACA to direct $10 billion through 2020 toward prevention-oriented activities that will help slow the growth of healthcare costs. The fund's main initiative is the Community Transformation Grants Program, which aims to make measurable differences in chronic disease incidence and outcomes by supporting multi-sector collaboratives to make systems and policy change so that the healthy choice is made to be the easy choice in schools and other community and workplace settings. And in Arizona to date, over $9.4 million have been awarded in prevention fund grants. So considering the ACA's provisions around school-based health centers and the promotion of healthy school environments, I will now go into possible strategies for Maricopa County Department of Public Health and its partners to engage with the educational sector to promote health. And just for ease, I will from here on out refer to Maricopa County Department of Public Health and its partners as MCDPH. As previously mentioned, school-based health centers are critical to promoting health, preventing disease, and reducing health disparities for underserved youth. Considering the increased number of insured young people with the Affordable Care Act, as well as the opportunities for school-based health centers themselves, there are a number of opportunities for MCDPH and schools to work together to promote adolescent health. The first opportunity is strengthening the infrastructure and utilization of school-based health centers. As these centers will continue to be an important safety net provider and will serve as an entry point and source of primary care for children and adolescents, MCDPH can work with school-based health centers to prepare for the rapid influx of patients following insurance expansion through improving systems of enrollment and care, increasing the capacity for health information technology, and training staff about the provisions of the ACA to inform families about their new health benefits. Additionally, MCDPH can work with school-based health centers and other district and school staff to educate families within the school community about new insurance coverage options and benefits through their health plans. MCDPH can create toolkits and culturally competent and literate materials to equip school-based health center staff to enroll families from diverse backgrounds. With the ACA, furthermore, there is an increased emphasis on promoting primary care delivery through innovative models, such as the health home. Health homes are designed to be person-centered systems of care that facilitate access to and coordination of the full array of primary and acute physical health services, behavioral health care, and long-term community-based services and support. The health home model expands on what is traditionally known as the patient-centered medical home. School-based health centers are primed to be integrated into the health home model. MCDPH can work with the organizations in Maricopa County that are developing health home standards and recognition programs to identify school-based health centers as eligible primary care providers. Currently in the U.S., the most recent data estimates that 35% of school-based health centers are recognized by managed care organizations as reimbursable primary care providers. On this slide is a readiness assessment developed by the National Assembly on School-Based Healthcare to help school-based health centers identify whether they are ready to be considered as a medical home. Essentially, to be a health or medical home, school-based health centers need to ensure linkage so that services are available at all times, even when schools are closed, encourage parental participation and provide education about the healthcare needs of the youth they serve, work collaboratively with primary care practices, school districts, and community agencies, and coordinate all specialty and subspecialty consultations, referrals, and collaboration. MCDPH can work with school-based health centers to identify their readiness level and opportunities for improvement. Related to this, school-based health centers should also aim to follow health home standards required by public and private payers in order to demonstrate the highest level of commitment to quality improvement in patient care. MCDPH can also work to coordinate school-based health center care into the health home by linking them to community-based services and partnerships that serve children and adolescents, and also encourage community-based services to reach out to school-based health centers to provide their services in a school context. Related to the patient-centered medical home or health home model, the ACA promotes accountable care organizations as a model of care to increase efficiency and effectiveness of health care delivery. An ACO is a network of doctors and hospitals that share responsibility for providing care to patients. An ACO would bring together the different component parts of care for the patient, including primary care, specialists, hospitals, home health care, etc. And it would ensure that basically all of the parts work well together. MCDPH can advocate for ACOs to incorporate school-based health centers into their practices to avoid duplication of services and improve the health outcomes of beneficiaries. If school-based health centers are recognized as part of an ACO, and if they can document their effectiveness in promoting the health and wellness of their enrollees through care delivery, they could potentially obtain part of the reimbursement that the health system receives from the insurance company. Finally, MCDPH should work with, or can work with, school-based health centers to improve, integrate, and expand health information technology to engage them in the health information exchange. This will enable school-based health centers to better coordinate care across multiple providers in the school and the community, as well as coordinate care through the patient-centered health home. An example of this was seen in the Louisiana School Health Connection, which was established in 2008, which successfully established an electronic medical record system for school-based health centers in Greater New Orleans. This EMR management system resulted in systemized data collection and sharing with the other school-based health centers, safety net providers, and school district personnel, and allowed for better continuity of care and standardized record keeping. This would bolster revenue and system sustainability as well through integrated and coordinated billing. To accomplish this, an advisory committee was convened to recommend what data would be collected, which vendor to select, and methods for training clinic staff. MCDPH can work with school-based health centers to develop an EMR system or other health information technology infrastructure. Possible roles could include serving on an advisory committee, training clinic staff on health information technology systems utilization, facilitating the exchange of data between school-based health centers, student health homes, and other community-based providers, and information sharing to document best practices in school-based health center innovations. Furthermore, MCDPH can also perform data collection and analyses to document the impact of school-based health center services on health and educational outcomes and calculate the return on investment for prevention initiatives. At this point, the school-based health center capital program grants have been exhausted, and there are still no federal funds allocated for the school-based health center operations grant, as previously mentioned. However, MCDPH should work with school-based health centers to participate in advocacy for federal funds. Opportunities could come through partnership and participation with the National Assembly on School-Based Healthcare and the Arizona School-Based Healthcare Council. Also, MCDPH can work with school-based health centers to ready themselves to apply for future funding opportunities that could come. Also, with the anticipated healthcare coverage expansion, there will be a new payment source for many families who are formerly uninsured. School-based health centers will need to develop and streamline their systems for billing Medicaid and commercial insurers. Also, with the essential health benefits and the expanded preventive services that will be covered through insurance, MCDPH can educate school-based health centers on which services are reimbursable to maximize their billing. A good example of this is the School Community Health Alliance of Michigan. They received a grant to establish a centralized billing and reporting system that tracks clinical and financial data and enables school-based health centers to bill both public and private insurers for covered services. Over a 2-year period, 18 participating centers earned over $90,000 in additional revenues due to the streamlined billing process. MCDPH could work with school-based health centers to track the costs of their programs and develop a school-based health center-specific business plan using the School-Based Health Alliance Cost Survey. The purpose of the survey is to provide school-based healthcare stakeholders and advocates with accurate and up-to-date data on total school-based health center annual operating costs. The survey identifies the total costs, both monetary and societal, associated with the operation of a school-based health center. This information will assist school-based health centers with future programming and resource development efforts. So moving beyond now the school-based health center, MCDPH can also work directly with schools and school districts to support implementation of the ACA's National Prevention Strategy Principles for Schools. As previously mentioned, the NPS promotes looking beyond just clinical care and programs and instead creates healthy environments where people live, work, play, and learn in order to make the healthy choice the easy choice. The tenets are listed here, so I won't go over them in detail. But however, opportunities include conducting an audit of school environments to identify opportunities to promote a strong culture of health, and partnering with schools, school wellness advisory councils, and school boards and administrations to gain buy-in for implementation. The coordinated school health model is one comprehensive approach that meets all of the national prevention strategies for schools. Arizona's coordinated school health has been funded by the CDC since 2008 and has been a great partnership between schools and public health. The coordinated school health program model consists of the 8 components listed on this slide and necessitates the systematic and strategic involvement of multiple stakeholders, including families, healthcare workers, media, religious organizations, community organizations, and youth themselves. Though funding is coming to an end, public health can continue to strengthen and expand its multi-sector coalition of education leaders, community-based organizations, employers, and healthcare systems to design strategies to measure the impact of coordinated school health efforts and seek continued funding opportunities. Along the same lines of multi-sector collaborations, funding opportunities such as community transformation grants offer a platform to bring together partners to address CDC's priorities, such as making policies and systems change to reduce exposure to tobacco and increase healthy eating and active living. The visual on this slide illustrates the local public health system and the many, many players involved. Public health is in a unique position to convene these diverse stakeholders to collaborate on improving the health of the community. Schools could be an important part of this multi-sector collaborative to improve physical activity and healthy food access, as well as tobacco prevention across the county. This was done successfully in Boston, Massachusetts, through the Communities Putting Prevention to Work funding awarded to the Boston Public Health Commission. BPHC contracted with Boston Public Schools and nonprofit organizations, including Health Resources in Action, to engage youth and adults in school and district-wide policy change efforts to promote health. These efforts, which engage diverse stakeholders, including parents, teachers, students, principals, and representatives from BPS operations departments, ranged from incorporating salad bars into school cafeterias to creating and strengthening a cutting-edge tobacco-free environment policy. Youth engagement was critical to the success of these initiatives as they often identified the health concerns and identified practical solutions that would positively impact their peers. As new funding opportunities such as community transformation grants emerge, MCDPH should continue to engage multi-sector partners, including youth, to tackle policy, systems, and environmental change to promote health. Finally, schools as employers are primed to promote the health of their staff through the implementation of robust workplace wellness programs. Schools, their associations, and unions can partner with Maricopa County Department of Public Health and its Healthy Arizona's Worksite program to implement evidence-based worksite wellness programs and measure and share results. Strong workplace wellness programs address the creation of a healthy environment for employees. Through the Healthy Arizona Worksite program, public health can work with schools as employers to create a culture of health and implement evidence-based best practices and tools to create a healthy workplace. This includes providing opportunities for physical activity, offering healthier food in cafeterias and vending machines, and establishing smoke-free and healthy outdoor and indoor air quality policies. For example, to ease its rising healthcare costs, one company in Pima County, Arizona, decided to make healthy changes in the workplace, like offering healthy food in vending machines and creating a walking path. As a result of the company's efforts, health claims actually dropped by 70%, and employees lost 440 pounds as a group. MCDPH can work with schools to adapt such best practices to their context. And it should be mentioned that this would not only benefit employees, but also the students as well. Public health can also provide technical assistance and consultation to schools to conduct environmental assessments and provide suggestions for appropriate strategies to address identified concerns. And finally, MCDPH can encourage schools to support a healthy workforce by offering robust preventive insurance coverage through their employer-sponsored insurance. This is an important way of reducing healthcare costs for employers, as nationally, healthcare is the most expensive benefit provided by employers, making up 8.5% of the total employer costs for each worker. The majority of employer-sponsored insurance plans will comply with the ACA's preventive care mandates, which includes services such as immunizations and screenings, as well as the Essential Health Benefits Package, which are a set of core federally required benefits that you see listed here on the screen. However, plans that are grandfathered, which basically means plans that went into effect on March 23, 2010 or earlier and meet specific criteria, do not need to do so. MCDPH can encourage schools to phase out grandfathered plans that currently do not meet the provisions of the ACA. Instead, schools can be encouraged to offer plans that robustly cover preventive and wellness services, along with all of the other essential health benefits that are required of qualified health plans that belong to the insurance marketplace as a way to reduce healthcare costs. In addition, schools can promote the utilization of preventive services by employees by helping them understand their positive health impacts and free coverage. MCDPH can also provide consultation for schools or municipalities that purchase insurance on behalf of school departments on cost-effective insurance coverage that emphasizes prevention. So in closing, health departments and schools have a shared interest in improving the health of its employees and students, and schools are an important site to promote health equity due to its access and reach to diverse populations. Furthermore, school-based health centers are an important site to provide continued clinical and preventive care continue to be uninsured. And creating a healthy school environment that follows the guidelines of the National Prevention Strategy will have far-reaching impact. The ACA also creates opportunities for new and continued partnerships and shared initiatives, of which public health is a natural convener of such partnerships within the local public health system. Health departments can provide analysis and expertise and guide policies and practices, much of which is already started through initiatives such as the Healthy Arizona Worksite program. And finally, schools have the potential to be critical leaders for the promotion of health and prevention of disease and are important partners to engage in the goal of improving population health. So thank you so much for your time, and with that, I will now pass the mic back to Lori for questions and answers.
Hello, everybody, and hopefully you can hear me well. There have been quite a number of questions that have come in and a lot of interest in this topic, clearly. We may not be able to answer all of the questions right off the bat, but what we have arranged for with the Maricopa County Department of Public Health is for those things that we may need to research a little further, they will be getting back with you with some form of answering those questions in the future. So one of the questions that came in was, will there be mandates for physical education or health education to be taught in schools during school hours? I will take a crack at that, which is, we are talking about the Federal Affordable Care Act, and at this time, there is no indication that those kinds of regulations will be coming down from the federal or national level. If those kinds of regulations tend to come from the state level or through guidelines at the district level, But at this time, the Affordable Care Act, we don't see any kinds of regulations relevant to promoting healthy school environments. Another question that came in was, will the appropriation for school-based health centers be renewed in the future? Brittany.
So that's a really great question, and right now at the national level with the National Assemblies for School-Based Health Centers, as well as at the state level, there's the Arizona equivalent of the National Assembly. They are engaged in a lot of advocacy around getting further appropriations for funding for the capital grants as well as the operation grants. However, right now there is not any indication that that has been set yet. But this is why we suggested this as an opportunity for Maricopa County and its partners in the educational sector to really partner with these organizations that are trying to get to promote appropriations for school-based health center capital grants and operation grants. This Affordable Care Act, as I mentioned, the capital grants were really only for the first 3 years. Operations grants have not yet been appropriated, and so that's where a lot of advocacy is happening right now.
Good. There is a question about what are the demographics of children who will not be insured after the ACA is fully implemented, and what access to health care will they have? I can try and take a stab at that. You know, the vast majority of people will be eligible for coverage of health insurance and will actually have to get health coverage, although there are a lot of opportunities for getting reduced there will be opportunities for getting reduced costs through the insurance exchange for and tax credits for people who are lower income or through the Medicaid expansion. But as in Massachusetts, for instance, where health reform has already been implemented and the Federal Affordable Care Act was basically formulated after, we still have a percentage of people who are still not covered. They're mostly adults and not children, but nevertheless, there will be some children who will not be covered. And there are a variety of reasons for those. Some, for instance, may be undocumented immigrants. Others just simply, other families just don't know how to get themselves enrolled. Some fall within the cracks of coverage. So it's not a perfect situation, but the overwhelming majority of children will be covered. But for those who are not covered, how will they get access to care? Well, at this time, there are, there's not any anticipation that any of the current safety net providers are going to go out of business or stop providing care. Actually, what they will be able to do now is bill for a lot of care that is being provided to people who are currently uncovered. But it's not like they will be going out of existence, nor will they be most likely stopping to cover those or to treat those who lack coverage. So just as now, for those who are not covered by health insurance, there will be a continued need for a safety net provider system, and we anticipate that will continue. A related question was, will school-based health centers be able to refer patients to health care? My understanding is that is one of the main roles of a school-based health center is, while they will all be a provider of care, they also encourage patients to have another primary source of care as well. And so we anticipate that there will be referrals, more referrals of children to primary ongoing care, and that they will continue to get care at school-based health centers.
And just to add one thing, Lori, this is why the recommendation and the emphasis of the ACA around health homes is so important. By trying to integrate school-based health centers into the health home model and readying school-based health centers to be integrated into the health home model, we can provide more coordinated care for young people, as well as school-based health centers can refer out to the community and vice versa. So that is definitely one of the most important things to think about as we're working with school-based health centers.
Great. And then the last question that we see for now, and feel free, we'll give you another minute to type in your questions, and we'll be happy to answer them. How easy will it be for rural Arizona schools to obtain funds for school-based health centers? Who will they need to partner with? Is the funding exhausted? Schools are slashing their budgets right now for teachers, and state funds for schools are dwindling. So how can we establish school-based health centers in rural areas where there's need when budgets are so tight? You know, I think that the question is a really good one, and you know, it is unclear when there'll be more funding to expand school-based health centers and operations. However, there are opportunities now that there is opportunities for insurance coverage, that if school-based health centers or schools reach out to their healthcare partners like health centers or accountable care organizations or other providers in the community, it's possible now that a partnership could be developed where a school-based health center might be started because there will be more insurance funding to support the operations of those school systems. So getting in order to start a new school-based health center, the issue of establishing infrastructure and systems for being able to support it through billing operations will be really important. And that's why it probably would make a lot of sense to partner with an existing local provider who has those billing capabilities and who would be willing to come on site and help to start a school-based health center would probably be the best option for you to explore.
And one thing to just add to that, so this is what will, these are definitely the recommendations as it pertains to the Affordable Care Act, but also, and this is the tricky thing around billing is really the reason why school-based health centers have diversified funding sources. And so beyond the Affordable Care Act, these multi-sector collaborations that can be formed through the educational sector and the local public health system can really help to, can poise school-based health centers or schools that would like to start school-based health centers to find new sources of funding through grants, federal government, other federal government funding, and so on.
Right, and we would recommend calling the School-Based Health Center Alliance, is that the name of the organization, to get some ideas for how to bring philanthropy to the table and other, and the health department, as well as private nonprofit or for-profit organizations to the table to do some planning. You don't have to reinvent the wheel. There are others who have done this successfully, and you can learn from them. Okay. I do not believe that there are any other questions, in which case at 11 a.m. we will start another webinar, and that webinar will focus on opportunities for employers in the business sector around the Affordable Care Act. So for those of you who are signed up, we will look forward to joining with you again, and we will start at 11 a.m. Thank you so much for joining us, and please do fill out that survey, which will pop up on your screen momentarily.